This is it recording?
Can I read it in a
The way you do this is retarded. The way you're like, oh, let's have it go later. You're live.
You're live.
I wanted to upload as its own video later.
Wait, it's not showing me.
Dear Abby, everybody's friend, common sense solutions to everyday problems, advice you can trust, what every teen should know. Dear teenager, you sent for this booklet because you want the answers to some questions that puzzle you. Because by definition, a teenager is someone who's 12 years old going on 13, as well as the 19-year-old about to turn 20. This booklet will contain some information that may seem either too elementary or too sophisticated for you. For that reason, I've divided it into chapters according to subject matter. Simply turn to the table of contents to locate the subjects of special interest to you. Over the years, an estimated 25% of my mail has come from teenagers, so I have a fairly accurate idea of what teenagers really want to know. However, times have changed dramatically in the last 2 decades, and many teenagers are into adult activities at a much earlier age than teenagers of previous generations. So with that in mind, I have included some problems that are now very much a part of the teen scene, namely drugs and sex. So dear teenager, what follows on these pages is what I think you want to know, a kind of survival guide to help you through the turbulent teenage years ahead. Love, Abby.
I love Abby, too.
P.S. If after reading this booklet you have not found the answer to your question, write to me for a personal reply, and please enclose a self-addressed stamped envelope. I might as well give the address, shouldn't I? Address, Abigail Van Buren, P.O. Box 69440, Los Angeles, California 90069.
Yep.
I'm not going to read the table of contents, but I will tell you what we're starting on. On being trusted. Don't call interest or concern spying or a vote of no confidence. Until you reach legal age, your parents are responsible for your health, education, and growth.
True that.
If you're overly secretive about what's going on in your life, of course, they'll pry. Everyone is entitled to some privacy, even teenagers. But if you're wise, you'll get it the easy way, by volunteering information. But be absolutely honest. Talk about your dates, your friends, where you're going, and when you expect to be home. If your parents don't trust you, there's usually a reason for it. Maybe you never tell them anything, so they assume you have something to hide. Or it can be that what you told them wasn't exactly true. Trust is built on confidence, and it takes a long time and clean record to build confidence, so start early. My bad. What, you already blew it? Well, that's too bad, but it's not the end of the world. Everybody screws up once in a while, and if you have, admit it, promise to do better in the future, and then go to work on doing better. You're a little more mature this year than you were last year, and we all learn from our past mistakes. In building trust, actions speak louder than words. It isn't what you say, but what you do that matters. When you're asked to do something, do it. Don't make excuses like you did when you were 9 years old. Perform like a mature adult if you want to be treated like one.
Thank you. That's true.
Be responsible for your own actions, and you'll earn your parents' confidence. Whom do you trust? Those who have been shown by their actions to you that they can be trusted. Your parents are aching to trust you. Start today to show them that they can, and they will. Trust me. Brothers and sisters, ever since the Dear Abby column was first published, I have received letters from young people saying, I hate my brother, I hate my sister.
So do I.
But brothers and sisters are just people like you and me. All needs and desires trouble is our needs, and desires frequently run into someone else's. He or she doesn't mean to get in the way, they just do. And your brothers and sisters, friends, usually not. They're just people, like all of us. Happy people learn to compromise. We all have an obligation to respect the other person's rights. In other words, a person's right to swing his arms ends where the other fellow's nose begins. Brothers and sisters, would you shut your fucking mouth? Brothers and sisters teach you to share and live harmoniously with others. This experience is invaluable, since it teaches you how to head a family of your own one day. So quit complaining. Your brothers and sisters are giving you lessons in tolerance and diplomacy. And they're free.
Hey,
about the telephone.
Wait, let me read this chapter.
Oh, about the telephone?
Yeah.
Get over here.
Yeah, I know. Let me in. Hi.
Hey, let me read the next chapter.
About the telephone. The telephone could be a handicap or it could be a great advantage, depending upon the wisdom in which you use it. There is nothing wrong with teenagers telephoning each other with invitations. That's a legitimate reason to call. It's annoying only when young people get telephone-itis and tie up on the line for hours while they just rap about.
That was just my solar plexus.
Well, they just rap. But calling is certainly okay if you have something specific to talk about. Keep in mind that there are certain rules or telephone courtesies. Learn early and make the telephone your ally. When you call, identify
It's
yourself
not that you're
immediately
trying
and
to
ask the
Yeah.
person
I understand.
whom you're
Mine
speaking
just
with.
hurt because this is solar play.
Hello, Miss Jones. This is Janie or Jimmy Smith. May I please speak to blank? Remember to speak up and sound confident. Don't mumble. Don't make anyone guess who you are. That's childish. If you are afraid, you'll be so nervous you'll forget the telephone manners. Write down what you want to say before you call, then read it.
Eric, look at the camera.
If he or she if he or she doesn't remember you immediately, offer a clue. You said you like my red sweater. If you call to ask for a date, specifically for a day and time, and explain what you have in mind so the person you're inviting will know what to wear. Don't call for a date at the last minute. It reduces your chance to get an acceptance. Gee, you should have called sooner. I promised to babysit tonight. If you get a no, your prospective date probably has other plans. If you get repeated no's, take the hint and call someone else. Always make the calls yourself. If you haven't the courage to call and ask for a date yourself, then you aren't old enough to date. Who's ready to go again now?
Me.
Johnny boy.
Yeah.
I got punched in the fucking stomach and it's red. Because
Alright.
my skin turns red easily.
Right there.
No, let me in the chair. So, wait, will parents split?
Yeah.
When parents split, the real victims of divorce or separation are too often by innocent bystanders, the children. Teenagers can usually withstand the emotional shock of a divorce or separation better than younger children, but even so, it is a shattering experience to be torn between parents. If your parents are splitting up, you probably saw it coming. An independent divorce is like the thaw of an ice floe. The grinding and crunching is heard before the final breakup. So perhaps you weren't taken entirely by surprise, but we all had the maturity and muster to handle the situation. Here are a few suggestions that may help you weather the storm. Don't make it your burden harder to split by feeling in any way guilty about the split. Children are seldom, if ever, the cause, or even a factor. What did you do? In a divorce or separation, don't make snap judgment and take sides. The circumstances that led to your parents separate are far more complex than they appear on the surface. Rarely is one part entirely to blame. Your parents have probably already been deeply hurt by each other, not you. Don't cause them more pain by blaming on one or the other. A divorce is not the end of the world, although it may seem like it at the time. It's better to live between parents than to live with them in a house and seething with bickering and quarreling, or constant fighting. As a teenager, you'll have a voice in choosing which parent you'll live with. This can be an agonizing choice, but try to make it a reasoned one, not an emotional one. If, let's say, your father decides to move to another city, you'd be advised to remain with your mother, rather than uproot yourself from school, friends, and familiar surroundings. This is just one example. I cited to show you that some factors may only consider that making a decision that only you can make. One more thing, don't feel sorry for yourself. And don't feel guilty or ashamed. It happens in the best of families.
I want to go next.
No, wait, no, I want to go.
Ruby, stop. Mr. Wrong calls.
No, it's my turn.
Let go.
No, it's my turn.
Hey.
Let go.
Hey.
Let go.
No, it's my
He's
turn.
gonna hit you, let go.
You can't read then.
Yes, I can.
Reading for nerds.
I'm sweating.
How do you say this word? How do you say?
God damn it! Why didn't you learn how to say a word?
I know. I'm just joking. Oh my gosh.
Ruining.
If you don't want to go with the young man, tell him you're busy. It isn't necessary to tell him exactly who you are busy with. Maybe you're busy ducking him. It's a kind and courteous way to refuse an invitation. Never accept a date to keep him on the string, hoping something better comes along. Then drop him at the last minute if it should. If you don't want to go with him, say no right off the bat so you can call someone else. Once girls leftovers can be another girl's banquet. Once you do refuse a date, don't blab about it. How would you like to have everyone know you were second choice? When you say I'm sorry, I'm busy, and he says how's about the next night or the next, it's time to bite the bullet and remember that honesty is the best policy. Tell him that you think he's very nice. and that you like him, but not that way. It's not really as cool as it sounds because you are turning him loose to date someone who might like him. It's kind of more honest than just going with him anyway, when you feel nothing but sorry for him.
Oh, I want to read. Okay, I'm reading.
What am I reading?
Tyler.
Mr.
Wait,
Right calls, you've got the date. How do you act?
Can I call Tai Tai?
Or the blind date.
Can I call you Tai Tai?
What am I reading? The blind date?
No idea.
Hey Tyler. Is it weird to call you Tai Tai?
Yes.
Okay.
Thanks.
Mr. Right calls. You've got the date. How do you act? Well, be ready on time. Invite your date in and introduce him to your parents. Mom, Dad, I'd like you to meet Harry Beckwith. He's the goalie on our hockey team at school. Don't babble constantly or try to be the world's greatest comedian. Let the boy know you are interested. Look him straight in the eye when you talk to him, alright? And if he's not talkative, ask him questions. Some boys are very quiet on the first date because they don't know what to say. Don't talk about other dates. Concentrate on your date and crowd. You wouldn't like it if you didn't do the same, would you? Don't clown or wrestle. Many boys are socially unsure of themselves and they find it embarrassing to be with the noisiest girl in the place. As for wrestling, I wouldn't recommend it on a date unless you are prepared to lose. And besides, it's unladylike. Relax. Be yourself. Be a good listener. Don't
Make out with
gossip
them.
if you're having a good time. Say so. Go with boys your own age. It's safer and wiser. Don't make a beauty parlor out of the restaurant table. A quickie lipstick replacement is okay, but for hair combing and other extensive repairs, excuse yourself. But don't disappear in the powder room for a lengthy stay. Talk about it with the girls tomorrow. What about a good night kiss? Only if it's mutually agreeable. Otherwise, it could be mutually embarrassing. The blind date. A blind date can sometimes bring together a couple of wonderful people. At other times, it only serves to bring together a wolf and a sheep. So bear this in mind.
True.
And accept a blind date with one eye open. If it's one of those last-minute phone calls from a casual acquaintance, frantically trying to line up for, a guy with a car, look out, sister. If you've seen the fellow and know something about his reputation and background, you'll be with people you already know. It's probably all right. But if you don't know who he is and he can tell you about himself, he's a friend of so-and-so's and he's seen you and has heard a lot about you, better skip him until you know more about him. If someone you know asks you to accept a blind date with a newcomer in town or a visiting cousin, first consider the go-between. If that person is a solid citizen, don't put him through the third degree asking, how tall is he? What color eyes does he have? Etc. Say yes, it's only an evening, not a year's contract. Chances are the guy is standing by the phone anyway, and you'll make points for being a good sport. Who's chicken? A square is a little four-sized gizmo that won't fit into a round hole. That's a square. Nobody wants to be one. Squares don't conform. They don't do what everyone else is doing. They have a few ideas of their own. But you're not square. When you're challenged to a drag race, you'll go along. You'll risk shattering your noggin into 100 interesting little pieces because you don't want to be called chicken. How about cutting classes because a couple of kids decided to, and you're invited to join them? No, can't be a chicken about that either. It's either joining them or risk being considered square, or not one of the, gang. If you know what I mean, yeah? Mm-hmm. Yeah. Same goes for drinking when you're under the legal age, and trying marijuana, cocaine, or venturing into the heavier stuff. Ditto for going along with a little shoplifting just for the heck of it, or maybe borrowing a car for a joyride. Meanwhile, who's kidding whom? Innocent fads with like hairstyles or clothing are one thing, but when it comes to being enticed into acts that are senseless, dangerous, legal, or immoral, it's the squares. The kids who value their self-respect more than mob respect, and the kids who care about their reputation, who really show courage by saying, no thanks, I'll pass, it takes a lot more guts to go along than to follow the crowd. So who's chicken?
True.
The guy who accepts any challenge head on because he fears being different, or square? He hasn't got the strength to act for himself. So redefinition, a square is a little four-sided gizmo that can't be squeezed into a vicious circle.
I'm in the next chapter.
No.
I go next.
Okay, I sit in the hot seat though.
No, I move you the hot seat over. That's the plan. You alright?
Yeah, you ran him over my...
Is it love or isn't it? For one thing, it takes a level head to control a foolish heart. Can you love someone at first sight? This crazy mixed up version is better known as infatuated at first sight. Infatuation is possibly be the first step towards love, but in itself is not love.
Ow! Jesus Christ!
Love itself is
Ow.
built on inner realities, through experiences and a few more infatuations. One acquires a second and better sight, so mature love should be called love at second sight. Mature love means liking a person as well as loving. It's the most important part of a relationship is physical, making out, and you don't seem to have much talk about it, face it. You're just a physical attraction. You're really not a good combination if you think of a long-term relationship.
I like
How
both.
do you know if you're in love? To ask if it is love and indicates doubt. Love is sure. Don't confuse enduring and lasting love with puppy love. That's the kind that usually gets you into an emotional doghouse.
Looks like I'm wearing lips.
Love is giving, not taking.
Mine looks
It
like I'm
wants the
wearing
best
lipstick
for
on
one
this.
you love. Love is on the go and makes you want to charge out into the world and do as well as think big. It doesn't keep you inert, daydreaming and cooping up with only one person. Love wants to share to the one you love. You give your thoughts and dreams. A new happiness comes from sharing them. Mature love is honest and open. Love doesn't know what time it is. During your teens, you'll have a leader of puppy love. But as time goes, you'll learn more about the object of affection, and that love seems to grow not weaker but stronger.
Stop dying.
Maybe the real moment has come. Breaking up, or what to do with the pieces. Speak only well of each other, or not at all, after the break. Attending parties and school affairs and develop new interests. Keep busy. Avoid the old reminders which tend to make you moody and broody. Get rid of pictures, photos, and gifts unless you enjoy punishing yourself. Turn a deaf ear to anyone who wants to pry or question you. Girls, a boy says it is all over when he stops calling. Usually he gives no reason, but he has them. This means it's time to forget them. Boys, a girl will generally give you a reason. Accept it. Whatever it is, this means for you too, it is time to move on. Once it is over, all the note writing, phoning, or conversing conniving, that's probably it, will not help your cause. Don't ask a mutual friend to help you get him back. This only makes you appear foolish. For all you're chalking up to experience and part of growing up, there is no growth without a little pain. It only hurts for a while.
Let me.
Yeah, you did.
Move.
Wait. Okay, fine.
Whoa! Jesus Christ! Jesus!
my area.
Ow! You
Then
Fuck.
just leave.
no!
Damn! Stop fucking cussing.
Ran over my foot.
Are you ready for sex? Age has nothing to do with it. As a service of teens who might need it, and my mail tells me, no, there was enough for concern. Well, and my mail lets me know that there was enough for concern. I published a toll-free hotline telephone number for kids to call for information about sexually transmitted diseases or STDs, and where I go for free examination and treatment. I later learned that those lines were flooded with calls from kids, some as young as 10 years old. Maybe hard to believe, but statistics show that babies might have been born to unwed mothers at 11 years of age. So it shouldn't be a surprise to learn that some youngsters become sexually active at age 10. That's crazy. The most difficult word in English language is to say is also one of the shortest. It's no. Yet the inability to say a simple word can complicate your life in ways you can't even imagine. Particularly, you okay? Whenever it comes to sex. Sex among teenagers who aren't ready for it has had serious results in our society, and these results are potentially catastrophic. Sexually transmitted diseases are an epidemic that can cause sterility or death. Pregnancy is a leading cause of school dropouts. A fourth of all abortions are among teenagers. Babies born to teenage mothers are more likely to be brain damaged or retarded. Attempted suicides among pregnant teenage girls are 70% higher than other groups. At least 60% of all teen marriages end in divorce in the last 5 years. What's wrong with having sex? Nothing. It's normal, it's natural. Everyone has Everyone in this world except tested babies and those born through artificial insemination. Nice. Got here the same way. As a result of a single-sex act. What are you saying?
No, it's talking to
So depending on your age and if you're in good health, you will at some point develop an instinctive craving for sex. Sex is a part of life, an important part. What's happening in there?
I don't know.
Damn, I'm getting off. But it is only a part. A part too much emphasized today in the movies, on TV, and what we read. It's also a trap for those who don't know what they're getting into. The sex acts is the most intimate relationship between two people, but this is not only physical. Sex has emotional strings tied to it. Almost always, one or the other, boy or girl, becomes possessive, jealous, angry, and sometimes even violent. What you might have thought is a simple experience in growing up when it comes to a problem that will lay an adult burden on you before you're adult enough to handle it. But I'm not going to lecture you about sex. I'm here to point out a few things that will help you decide. What?
No, keep reading.
Oh. It will help you decide whether you are ready for it. Surveys show that 70% of females and 86% of males have had sexual intercourse by age 20. I know I'm stuttering. But some of you are saying no, and avoiding a world of trouble and emotional upheaval at time when you've got to get your head together and cope with the problem of growing up. Such as continuing your education and preparing for the rest of your life. If you do have sex on the impulse because you got carried away or just didn't want to control yourself, it's apt to be a disappointing and upsetting experience. You will feel guilty, ashamed, and oftentimes worried about it afterwards. This can harm your future sex life. If your partner is using you, or you are using your partner, and you don't really care deeply about each other, you're not ready for sex. Of course, there are some teenagers who go all the way because they really do care deeply about their partners, and are sure they're in love. But those who are sufficiently mature and can handle love-sex relationship will protect themselves and their partners from an unwanted pregnancy as well as STDs. When teenagers write and ask me if they should go all the way, I always say don't. The reason is obvious. Someone who asks is not sufficiently mature to handle it. The mature person realizes all the responsibilities that can come with a love-sex relationship. I repeat, one of them is making sure that there will be no unwanted children. Making love sometimes makes babies, or spreads infection, or disease. I stuttered. Even the most sophisticated precautions can fail, resulting in pregnancy or disease. Nature has played a dirty trick on us. A male reaches his sexual peak in his teens, but a female reaches her sexual peak in her 30s and 40s. Boys and teens are too young to marry and have families, but they have the strongest sex drive in this period of their lives. Unfair, isn't it? But it's true. And since the sex drive is so strong, natural instinct, no matter what I say, a lot of kids are going to have sex before they're in a position to get married. So I urge them to take precautions against unwanted babies, as well as sexually transmitted diseases. I am not condoning sex without marriage. I am merely being realistic. Sex control. What?
Nothing. Just keep reading.
Okay, sorry. Sex control or birth control, if you're having sex for reasons other than having a baby on purpose, is as much the boy's responsibility as it is the girl's. My mail tells me that an alarming number of teenagers find themselves in trouble, STDs, or pregnancy because neither one was prepared for sex. It just happens, they say. When they explain that they come prepared to go all the way, it's wrong because it's lust, just plain raw sex for sex's sake. But if you aren't prepared and the feeling just overwhelms you and you succumb to it, then it's love. That's not come, that is succumb. Rubbish. When the desire to have sex overwhelms you, and you succumb to it, his sperm and her egg don't know or care whether it was lust or love. The result is the same. You're both in big trouble. Sorry, that was so long. I stutter, and yeah.
It's fine.
Eric, what are you watching?
Also,
Anime.
I was not talking about your stuttering. I was telling you not to play copyrighted music.
Oh, okay.
Feel the need to make a shout out. So, This part's for Call Me Carson, you know. If you somehow find this video on your Discord or,
You're just.
you know.
Well, I know what's the cringiest moment in this video.
Shut up. Masturbation. This will be the shortest chapter in the booklet. Why? Because all you need to know about masturbation is this. It is normal. Every healthy, normal person has masturbated. Now, I will tell you what it's not. It's not depraved, a crime, or harmful to your health. But if it makes you feel guilty because you've been told it's wrong, don't do it. I repeat, all normal boys and girls, and some adults too, practice this natural type of sexual gratification. Call me... No, I'm sorry, man. I have heard from literally thousands of teens who have gotten written to confide that they think you are gay. I ask, how can I tell for sure? If I am, is there any cure for this condition? And what causes homosexuality? There is further more misinformation about homosexuality than any other subject. Small wonder people are so confused and uptight about it. First, let's define sexuality. Homosexuality. A homosexual is one who is in adult life prefers someone of his or her own sex in a sex-love relationship. One who is bisexual is equally turned on by a person of either sex. What causes homosexuality? Perhaps it would be easier to tell you what doesn't cause it. Childhood experimentation. Nearly all kids have homosexual experiences and even dream homosexual dreams. It's normal and nothing to be ashamed of. Many adults have the same thoughts, dreams, and fears. It's important to remember that a few homosexual experiences while growing up do not a homosexual make. It is not the result of having been molested as a child.
Yes, ma'am.
Yes, ma'am.
Homosexuality is not strictly environmental. The theory that a boy who is raised by a strong, domineering mother and a weak or absent father is programmed for homosexuality is absurd. I completely disagree.
What?
I think
What
Call
did
Me
it say?
Carson is homosexual. If that were a valid theory,
Wait, what did
how
it
does
say?
one explain why, in a family of 4 children, 3 turned out to be heterosexual and 1 homosexual?
That's
They
true.
all had the same parents and the same environment. Is homosexuality caused by a glandular or hormonal imbalance, or is it a matter of arrested development? There is no conclusive evidence to support either of those theories. At one time, homosexuality was classified as a mental disorder. The American Psychiatric Association has since discarded that definition. Although we are yet uncertain as to what causes homosexuality, behavioral scientists agree on one point. One's sexuality is not a matter of choice. It is entirely possible that one's sexuality was predetermined while the fetus was still in the womb. Can a person's sexual orientation be changed? Some psychiatrists say that the person who is very strongly motivated to change can, but the person must want to change. However, I have never heard from a person who changed his or her sexual feelings.
That's never true.
Behavior,
I mean,
yes. Feelings,
sorry.
no. Yeah, I agree with what you're saying. You know,
can't choose who you like. Like, you can't say, "Oh, I want to like."
Yeah.
I choose to like this girl.
it is a common misconception that you can always tell a homosexual by the way he or she walks, talks, dresses, etc. Yeah, you can. You totally fucking can.
What?
Tell if someone's fucking gay. The
I have a gay friend.
effeminate, limp-wristed, lisping guy who walks funny is not necessarily gay. Neither is the woman who wears no makeup, has a boy's haircut, and prefers trousers to skirts necessarily a lesbian.
That's true.
There are beautiful, feminine Hollywood sex goddesses who are lesbians, and there are professional football players, police officers, and typical masculine, muscular, all-American types who are homosexual. So what, like Ellen?
You call him Melissa.
Like Ellen DeGeneres?
Oh yeah, you call him DeGeneres, yeah.
Subscribe to It's Just Nick. His boyfriend is gay. I mean, yeah, his boyfriend is
Wait,
of
what?
course
Okay.
gay, but he's also
It is estimated that between 1 and 10% of the general population is homosexual. The exact figure cannot be determined because even though we have come a long way in the last decade in recognizing a person's constitutional right to be whatever he or she is, some people are still uncomfortable about their sexuality if they happen to be in the minority, so they remain in the closet. How to get pregnant?
Oh boy.
Well, you see, the cum mixes with the egg and creates a baby.
That's basically about it.
One of the questions I have been asked often by teens is how far can I go without getting pregnant? That is not a dumb question. It's a very intelligent one. A lot of kids get aroused by just lying close to each other while kissing. Then they
True.
just naturally proceed to the next step, which is petting. Sometimes they remove some of their clothing because it's in the way, or they borrow underneath their clothes to explore each other's bodies with their hands.
Yep.
This is known as heavy petting, or doing everything else but. Yeah. The technical and legal definition of sexual intercourse is penetration. The male sex organ must penetrate the female's vagina.
True.
However, as impossible as it may sound, the medical literature cites cases where there has been no penetration. The girl remained a virgin, but after engaging in heavy petting, found herself pregnant. How can that be? Simple. The boy and girl were lying very close to each other, unclothed, doing everything but, when a small amount of sperm leaked out, not inside, but very close to the girl's vagina. The sperm got into the moisture around the vagina and found its way up into the vagina and fertilized the egg. There is also a more obvious way to get pregnant: penetration without adequate protection. Some intelligent questions and some straight answers. How should a girl be when she starts having regular pap tests, annual screenings for cervical cancer? Girls should have a pap test every year if they are 1, over the age of 18, or 2, under age 18 and having sex. How old must a girl be before she can get pregnant? Age is not a factor. The degree of physical development is. Some girls are physically developed, have formed breasts, and have regular menstrual periods at 11 years of age. Others do not until they are 14 or 15. Although it is rare for a girl to become pregnant before she has had her first menstrual period, it is not impossible, and according to recent statistics, the younger the boy and girl are when they become sexually active, the higher risk of pregnancy, because they are less likely to use any kind of contraception. How old must a boy be before he can father a child? A boy can father a child from the time he experiences first ejaculation. This usually occurs in boys between the ages of 11 and 15. What time of the month is a girl 100% safe? Unless a girl's menstrual periods are 100% regular, there's no absolutely safe time, and because very few girls have perfect regular cycles, this type of birth control is unreliable. Can a girl get pregnant having her first intercourse? Yes, and many do. Can a girl get pregnant if she has intercourse during her period? Yes. Let's talk about contraception, or how not to get pregnant. The only absolute 100% way to not to get pregnant
abstinence.
is not to have sex. According to current estimates, 75% of unplanned teenage pregnancies occur to teens who do not use contraception. There are several different forms of birth control, but not all of them provide equal protection against pregnancy. Below is a list of the different kinds of birth control in order of their effectiveness. Out of possible 100, the chances of getting pregnant are the following: Norplant, less than 0.5. Depo-Provera, less than 0.5. Birth control pills, less than 1. IUD, less than 1 to 6. Diaphragm, 2 to 20. Vaginal sponge, 9 to 27.
What is
Aerosol
this?
foams, 2 to 29. Condoms, 3 to 36. Gels and creams, 4 to 36. Rhythm, less than 1 to 47. No birth control used, 60 to 80. Norplant, it's more effective than the pill, as effective as surgical sterilization. It consists of 6 thin flexible tubes, which are implanted under the skin of the woman's upper arm. And capsules must be inserted and removed by a medical professional. Norplant protects against pregnancy for 5 years and must be removed at that time. The capsules can be removed sooner if desired. Insertion takes 5 to 10 minutes and removal 10 to 30. Both procedures use local anesthesia. The capsules are usually not visible and become effective within 24 hours after insertion. In the 5th year after the capsules have been removed, if a woman still wants to use birth control, a new set of capsules can be inserted, or another form of birth control can be chosen. Within 1 month after Norplant is removed, a woman will return to her previously fertility level. Depo-Provera, DMPA, is an injection, or a shot, given every 12 weeks by a medical professional. DMPA is as effective against pregnancy as Norplant and surgical sterilization, and is more effective than all other birth control methods, including the pill and the IUD. The first shot of DMPA must be given within 5 days after the beginning of a woman's period, unless she is currently using the pill or an IUD and is effective within 24 hours. The medicine slowly wears off over time. After 12 weeks from the last shot, you must obtain another shot to continue protection against pregnancy. If you stop taking DMPA, it takes an average of 9 to 10 months from the last shot before you can become pregnant. Some women become pregnant 3 or 4 months after the last shot, while for others it takes a year or more. The pill. A woman considering the pill should know that there are several different kinds of pills. Only a doctor can tell after an examination which kind is best for you. That's why you should never use someone else's pill. If a woman is on the pill, she must follow instructions to the letter, never missing even 1 day. If she does, the pill provides no protection at all. If used properly, however, it is almost certain to prevent pregnancy. The IUD. This is a small plastic device that the doctor or medical specialist places inside the woman's uterus. Once placed there, it is permanent and requires a doctor to remove it. The diaphragm. A small rubber cap. Is it diaphragm?
It's diaphragm.
They spelt it wrong.
No,
Yes.
diaphragm has a D in it. It's
Oh.
weird.
That's weird as hell.
English is weird.
A small rubber cap that fits inside the vagina is used, or it must be fitted by a doctor or medical specialist, and is used along with a spermicidal
Yeah, I'd
cream
rather use
or
Colin for
gel
nothing at all.
containing non-oxynol 9. It is imperative that the diaphragm be properly fitted. The condom, or a rubber. Always use a condom made of latex rubber. A latex rubber condom used with a spermicide containing non-oxynol 9 provides the best protection. It is important to follow the instructions to the letter because occasionally condoms can break or leak, and most breakages occur from improper use. Never use an oil-based lubricant or hand body lotion, baby oil, or Vaseline, because oil-based lubricants cause condoms to tear or break almost immediately. Use only water-based lubricants. The female condom. There is a new product, the Reality Female Condom, which a woman can use to protect against pregnancy and STDs. It is particularly important if her partner can't or won't use a male condom. The female condom is made of a thin but strong plastic and has 2 rings and can be inserted up to several hours before sex. A lubricant is provided, but a spermicide with non-oxynol 9 should also be used with the female condom. Reality provides a similar level of protection as a male condom, and like the male condom, it should be used with every sex act. The sponge should always be used with a spermicide containing non-oxynol 9, following the instructions carefully. Suppositories. Some suppositories are designed to prevent pregnancy. Be sure that the pharmacist gives you the spermicide kind and follow the directions carefully. Douching. Douching is a method of feminine hygiene only. It is not a form of birth control. In fact, douching may increase the risk of pregnancy. Feminine hygiene sprays and most suppositories are not contraceptives. They are deodorants. Unfortunately, some of their ads are misleading. It is important to note that none of the above listed methods of birth control provides any protection against sexually transmitted diseases, except the latex condom with spermicide non-oxynol 9 and the Reality Female Condom. Remember, women who never use protection, use it incorrectly, or rely on their parents to use it instead are called mothers. Sexually transmitted diseases. Sexually transmitted diseases, or STDs, are at epidemic levels today. Every year, approximately 3 million teens and almost 9 million adults aged 20 or over are infected with a sexually transmitted disease. Sexually transmitted diseases are spread through direct sexual contact with an infected partner. The problem with sexually transmitted diseases is that people can have them, not know it, and pass them on. Almost all of them are curable, but the sooner they are diagnosed and treated, the easier they are to cure. Also, early treatment reduces the likelihood of transmission with others. You usually cannot tell by someone's appearance if she or he has a disease. Often, it's the person you would least suspect, the immaculate, perfectly groomed, decent, church-going boy or girl you trust the most can have a sexually transmitted disease.
I don't have an STD.
All it takes is just once with an affected person, and you are infected too. How many sexually transmitted diseases are there? There are approximately 50 diseases, syndromes, and complications. I'm going to discuss only the most common and the most serious 6 STDs.
Gonorrhea, HIV, AIDS.
AIDS and HIV infection. AIDS, or acquired immune deficiency syndrome, is the most feared sexually transmitted disease today because there is no known cure for it. It is caused by HIV, human immunodeficiency virus, which destroys the body's immune system, and with it, the body's ability to fight off disease. I actually know what happens. It just takes the cells and duplicates and totally ruins the system to where they can't fight back.
It destroys your immune system.
Yeah,
That's
literally,
why the
it'll
common cold
be
kills
like,
you.
I'm gonna get inside your white blood cell and duplicate.
Okay, wait. I
Yeah,
have a question though.
That's the
What
virus.
is
The
it?
common cold can kill
Virus.
someone with
Wait.
HIV and AIDS.
AIDS are basically just messing up the immune system, right?
Yeah.
So wait,
AIDS happens
why
whenever
is
your
it
immune
that
system is
why
weak.
can't? So wait, they don't tell you about AIDS until in like middle school because it has something to do with sex, right?
Yeah.
Yeah. Alright.
Yeah.
It's sexually transmitted. Eric, get back in here.
Although it can be transmitted through any kind of body fluid.
Once infected, a person becomes a carrier of the virus. While it may take 5 to 10 years before its symptoms appear, the carrier, unaware that he or she has been infected, can spread the disease with every sexual contact. In the following discussion, the term AIDS is used to mean HIV infection. Whether or not a person has the symptoms of AIDS, who is at risk for AIDS or HIV infection, the following risk behaviors or conditions will place you at increased risk of having AIDS or HIV infection. Having sexual intercourse with an infected partner without using a latex rubber condom, particularly anal intercourse. If you don't have proof that the person is not infected, assume that they are. Multiple sexual partners. Sharing needles with individuals who inject drugs in their sexual partners. Having received blood transfusions or blood products prior to 1985. Infants born to AIDS or HIV infection mothers. Where do you go?
I didn't know.
Hey, Dawn. Yes, that's it. I'll take the water.
Hey, can I read my instructions?
Yes.
Read one.
This one's very long, though.
Yeah.
What can we do to prevent the spread of AIDS? Oh, wait. No. Having received... Okay. To
Also
prevent the
known
spread of
as
AIDS.
don't
From a
do
public
this.
health point of view, the best defense against AIDS is total abstinence. Are confining sex to an uninfected partner who is 100% faithful. Those who do not abstain from sex need to know with absolute certainty that the person with whom they are having sex is not carrying the AIDS virus. If you are not absolutely certain, then you must protect yourself and act responsibly. First, don't have sex with someone who indulges in high-risk behavior. For an instance, a prostitute or drug user who shares needles. Avoid sex with anyone who is known to have had many sex partners. Oh, thank you. Do not knowingly have sex with anyone who has AIDS or who is infected with the virus. Second, if you do decide to have sex, if you are a man, use a latex rubber condom from start to finish, including foreplay. If you're a woman, make sure your partner uses a latex condom. It won't provide 100% protection, but a latex condom used with spermicide offers reasonable, but not 100% protection. A fresh new condom must be used every time you have sex. Yeah, because sure, I want to reuse a fucking condom with my cum in it. Can AIDS be spread by oral sex? Yes. Can AIDS be spread by deep kissing, wet kissing, or French kissing in which saliva is exchanged?
Yes.
To date, there has not been one case of AIDS recorded from only kissing. How AIDS is not transmitted.
Dry kissing.
According to the American Red Cross, AIDS is not transmitted through casual contact. Family members and healthcare workers who have taken care of AIDS patients have not contracted the disease. AIDS is not transmitted by handshakes or sneezes or even light social kisses. It is not transmitted in swimming pools or spas, on drinking vessels or toilet seats. And according to Dr. Mervyn Silverman, president of the American Foundation for AIDS Research, AIDS is not transmitted easily or casually. Not by a sneeze, not by a touch, not by being in the same room with an infected person. AIDS cannot be transmitted by sharing eating utensils, hugging, holding hands, swimming, or any other form of casual contact. Study after study has repeatedly demonstrated this fact. This has been confirmed by the Centers for Disease Control in Atlanta. AIDS can happen to anyone. People with AIDS do not deserve punishment. They deserve our compassion and understanding. They need our love and support. AIDS has changed all the rules, and until a cure is found, all sexually active people owe it to themselves and their partners to be very, very careful. Here's a good one, boys. Chlamydia. Herpes and genital warts are the most common STDs. Chlamydia is the #1 sexually transmitted bacterial infection in the U.S. conservatively. 3 to 4 million people get it every year. 50% of its victims experience no symptoms at all until months or years later when they develop complications. The only way many learn that they may have chlamydia is if a partner is sufficiently responsible and mature to warn them they have been exposed. Some men may notice a discharge from the penis and a burning sensation when they're urinating. Are burning and itching around the opening of the penis. The symptoms in women can be vaginal discharge, itching, or unusual pain, or low-grade fever. If you suspect that you have chlamydia, the only way to be sure is to be tested by a doctor. Do not let it go. Chlamydia, if left untreated, can cause chronic pelvic pain, tubal pregnancies, sterility, and permanent damage to the reproductive organs of both man and woman. If a woman gives birth while she is infected, Her baby can be born with the eye and lung diseases. The good news, chlamydia can be easily tested from the doctor's office. It is treatable, but the doctor's instructions must be followed to the letter. Then a follow-up examination is needed to assure that the cure is complete. Of course, your partner or partners must be tested by a physician, even if there are no symptoms, in order to prevent reinfection and complications. Chlamydia can be avoided by abstinence or the use of the condom. Genital herpes. Herpes is a disease which is highly infectious. It too is caused by a virus entering the body through a break in the skin or mucous membrane. When the disease is active, sex partners can pass it from one to another and can reinfect each other with each sexual contact. The early signs of herpes are tiny clusters of often pain sores, which look like blisters or cold sores on or around the sex organs, or in that general area. Sometimes fever and aching muscles or a generally sick feeling accompanies this disease. Other times the symptoms may be so mild as to go unnoticed. Once the virus is inside the body, another outbreak can be brought on by stress or a lowering of the body's immune system. Example, it has been proven that a poor diet, drinking alcohol, and taking drugs will lower the body's level of immunity. There is still no known cure for the herpes virus. Women who have herpes should be examined by a physician and have a pap test annually because the incidence of cancer of the cervix is increased after having herpes. And pregnant women who have had herpes should inform their obstetricians. I've never heard that word before, because a flare-up could seriously affect the health of their newborn babies. Condoms can reduce the probability of transmission, but are not 100% effective, since lesions can occur in new areas without symptoms. For free information on herpes and local support groups, write to American Social Health Association, Herpes Resource Center, Department T, P.O. Box 13875, Research Triangle Park, NC 27709, enclosed $1 for postage and handling. Genital warts. Genital warts are caused by the human papillomavirus. Okay. Oh, yeah, HPV. Okay. Over 25 million Americans are currently affected with this virus, and as many as 1 million new cases of genital warts appear every year. These warts are small growths or bumps that can be raised or flat, single or multiple. They can appear on any part of the genital area, internal or external. They spread by direct skin-to-skin contact during vaginal, anal, or oral sex. Some warts on the cervix lead to cervical cancer. If you think you have genital warts or have been exposed to someone who does, go to a doctor or clinic for an examination. There are a number of treatments available. However, at this time, there is no complete cure. Individuals with genital warts should use condoms, although they don't guarantee 100% protection, as the virus may exist outside the area protected by a condom, and the warts may not yet be visible. Gonorrhea. Fuck's sake, man. The symptoms of gonorrhea in the male are a burning sensation while urinating and a subsequent discharge of mucus and pus. However, some men have no visible symptoms. In the female, there may be a slight burning or itching, a bit of discharge from the vagina, and bleeding between menstrual periods. However, in women, it is common to have no symptoms at all. In cases where there are symptoms, they frequently disappear for a while, but that doesn't mean the disease has disappeared. It has just gone underground while the germs continue to do their work, and complications soon arise. If gonorrhea goes untreated, it can cause chronic pelvic pain, tubal pregnancies, premature delivery, and even sterility. You can catch gonorrhea as many times as you have sex with someone who has it. It's easily cured in its early stages. Syphilis. The early sign of this disease is the appearance of a sore that looks like a pimple or wart. It doesn't itch or hurt, therefore it can easily be overlooked. It usually disappears in 1 to 3 weeks, but don't be fooled. A host of new problems can appear. If left untreated, syphilis can cause paralysis, blindness, mental disorders, and even death. Pregnant women infected with syphilis usually pass the infection to their fetus. This can result in fetal death, deformed newborns, and mental retardation. Once cured, you can catch it as many times as you have sex with someone who has it. And yes, a person can have more than one STD at the same time.
Alright. I like shaving.
You better read with that enthusiasm.
Okay, let me read with enthusiasm.
I'll read with an extremely monotone voice.
Here, let me do it.
Fight you.
Excuse me.
What to do about a sexually transmitted or venereal
The
disease?
symptoms in gonorrhea are the male burning sensation while urinating, subsequent discomfort.
Where are you reading from?
Move. Just go lay down.
If you have any reason to suspect that you have an STD, don't panic. Help is available to you immediately, free of charge in almost every state. Minors do not need parental consent to get free examination and treatment. Cell phone for the National STD Hotline is a toll-free number that you may call from anywhere in your country. 1-800-227-8922. You may also call your local Department of Public Health. They too will provide free confidential examinations and treatment if necessary. Or call your local Planned Parenthood office. Consult your telephone directory. They will help you. Don't try to treat yourself and don't put it off. The earlier you're treated, the better. Of course, you should immediately notify anyone with whom you had sexual contact and inform him or her of your condition. The next to the best precautions against STDs is for the sexually active person is for the male to properly use a latex condom, rubber, or the female to insist that her sex partner uses a condom. This is a wise investment and protection against unwanted pregnancies as well as the most sexually transmitted disease. The best precaution against sexually transmitted disease, death. The best precaution against sexually transmitted disease is to refrain from having sex with anyone who has one. Those who have sex with multiple partners are most likely to be infected. But confine your sexually active to one unaffected partner and one partner only is no guarantee against STDs unless your partner confines his or her sex to you only. The more partners with whom you have unprotected sex, the greater risk of catching any sexually transmitted diseases. Don't be afraid to discuss safer sexual practices with your friends and potential partners. Don't be shy about questioning someone's sexual history or to answer questions honestly about your own, so you can both make the intelligent decisions. If you have any reason to believe that you could be carrying the AIDS virus, be tested for it. Should you test positive, don't panic. It is important to get counseling and obtain ongoing care from a physician. If your test negative and it has not been 6 months since your last possible exposure to an affected partner, get retested in 6 months. It may take as long as 6 months for evidence of virus to show up on your blood test. The Department of Public Safety listed in the phone directory. Often testing is usually free. Or call the national toll-free 24 hours AIDS hotline at 1-800-342-AIDS. You think sexually transmitted disease can't happen to you? Read the following letter from a nurse practitioner who worked on a college campus. Is an eye-opener. Dear Abby, I am a nurse practitioner in college health setting. Each year I struggle with how to get a message to our students that sexually transmitted disease, or STDs, are very much present on campuses across the nation. Trying to be a prophet of gloom and doom, nor am I assuming that every student who arrives on campus is or will be sexually active during his or her college years. But a healthy sense of vulnerability is good for all of us, regardless of age. Perhaps you would understand if I relate a few situations. 1. A young girl with a pelvic infection so severe that she must be hospitalized comes to a health center. Even with IV and antibiotics, there's no guarantee the fallopian tube are not directly irreparable damage. Her greatest fear is her parents will find out that she's involved in sexual relations. Mine is that she may never conceive a child or have tubal pregnancies due to scarring. Number 2. A young man brings his newest girlfriend to the health center with sore in the genital area. I have treated him for genital herpes in the past. He has struggled with how to tell her, and now he must. Confidentiality must be honored. I cannot and will not disclose to her that I know the young man. A young man called, frantically asking to be seen immediately. He has just learned that a young female student with whom he had unprotected sex is dead. Rumors that she developed an AIDS-related opportunic infection. It is true. His HIV is negative, but I don't know what the results of subsequent testing will be. 4. A young man is treated for urethral discharge. His test results are positive for gonorrhea. He had unprotected sex with a young woman at the off-campus party. They both have been drinking. He knows only her first name and the dorm where she resides. We're unable to locate her for treatment while protecting confidentiality of the male student. We also treat other male students with whom she had sexual relationships, and contact tracing continues. Meanwhile, the young man must go home and tell his fiancée that she needs to be treated for gonorrhea because they had sexual contact 2 days after he was at the party. Number 5. A young woman with a previous history of psychological problems loses touch with reality. Her illnesses involve acting out sexually. Over a 48-hour period, she has sexual contact with 20 male students. Number 6. 2 female freshman roommates have their first gynecological exams. On the day of the exam, one learns that she is pregnant. Several days later, the other learns that she has the HPV, the genital warts virus, on her cervix. None of these students thought it could ever happen to them. They are not ignorant, uncaring, or necessarily promiscuous. Often, the individual has only one sexual partner ever. All too often, the person who is ordinarily cautious gets the bad situation because alcohol has lowered his or her inhibitions. These students do not come from deprived backgrounds. Their parents are nurses, lawyers, ministers, and teachers, social workers. Government employees, and many, if not majority, are two-parent families. Alright. It did not mean to go so long-winded, Albie, but these young people are our future. College healthcare workers. College healthcare workers, dear healthcare workers, thank you for your enlightened letter and for caring enough to share your experiences. The 1992 annual report for the Division of STD/HIV prevention, published by the U.S. Department of Health and Human Services, reveal in part an estimated 12 million persons in the U.S. acquired a sexually transmitted infection each year. 2/3 of those occur in people under 25 years of age. Besides death, some of those most serious complications caused by STDs are infertility, adverse pregnancy outcomes, infancy death, mental retardation, and immune deficiencies.
Immunodeficiencies.
Shut up. It's immune.
It's immuno.
It's immune. It says immune.
Does it have an O in it?
It says immune. Right there. Right there.
2285. 2295.
Huh. I'm sure that none of those 12 million people thought it could happen to them, but it did. As you said in your letter, a healthy sense of vulnerability is good for all of us, regardless of age. Date rape.
What the fuck? Yeah, we should stop reading the book.
Chapter. Date rape chapter. Both parties usually start wanting the same thing, just to be together and enjoy each other's company. This suddenly goes wrong and rapes enter the picture. Date rapes usually occur in familiar. This information in the date rape section is substantially based on copyright material published and how it happens. Understanding Sexual Abuse and Date Rape by the Rape Treatment Center of Santa Monica Hospital and used with center permission. Copyright 1987 Rape Treatment Center, Santa Monica Hospital Medical Center. Surroundings such as parties or fellow car or home. It's either one or both are under the influence of drugs or alcohol. The situation can be critically dangerous. Stay sober and stay clear-headed. Sometimes a girl is set up for assault by a rapist who plans it in advance. He intentionally builds up the girl's confidence and trusts in him, then...
Reading a book.
He's reading.
Yeah, reading.
Oh.
Alright,
Ben, are you sleeping in here?
I muted the mic. I have to remember where it was.
Good games.
And then maneuvers her into a situation where she is vulnerable. In other cases, the rapist might not set out with the intention to rape at all. Trouble starts with a breakdown in communication. The boy and girl misinterpret one another's behavior. What?
Be quieter.
No.
Okay.
Or stop paying attention to their own feelings. For instance, the fellow might think the girl's behavior in certain situations is an addiction. That she's interested in having sex even though she was not said so. And the girl might have the funny feeling that something's wrong, but she may be afraid to speak up. If neither the person stops to find out how the other person really feels, misunderstanding can occur. Date rape happens when the fellow ends up forcing the girl to have sex without her consent. Because date rape can happen is so many difficult things. There's no magic formula for preventing it. Some situations, no matter what you do, you may never be able to avoid such a confrontation. But many teenagers, when faced with potential date rape, are able to prevent it. If both male and female are aware of how date rape occurs, they are better able to protect themselves against it. Probably the single most valuable weapon against date rape is communication. Let the other person know as clearly as possible what you want and what you do not want to happen. Just as important as how you communicate if you listen. Communication means making sure you understand what the other person wants too. On a date, when neither the fellow nor the girl stops to check out the other person's feelings, the situation can get out of hand. Communication clearly can prevent misunderstandings. The 3 cardinal rules for clear communication are: 1. Listen to your feelings. You can often sense trouble on the unconscious level before you know why you're in danger. Trust your instincts. Maybe somewhere deep inside, warning bells are sounding. Learn to listen to your gut reaction. Don't try to talk yourself out of them.
Thank you for listening, everybody, about sex ed. Please don't have sex yet.
Let your date know exactly how you feel and what your limits are. Verbalize it. Don't rely on ESP to get the message across. Do not assume the other person will automatically know or will eventually get the message. Spell it out. Make sure that how you say something is consistent with what you say.
Excellent.
Communication involves 3 things: what you say, your tone of voice, and body language. How you say something is often more important than what you say. If you don't pick up to, wait, no.
If you don't back up what you say, it's not perfect.
Tone of voice and body language, you may end up giving the wrong person a mixed message.
The other person.
Yep.
Example: if you want to say no but are afraid.
If you want to say no but you're afraid of hurting the other person's feelings, you may soften your refusal by avoiding eye contact, speaking softly. You will be much more successful in getting your message across if you look the other person directly.
Show Eric.
What?
Show Eric. Minimize it.
I seen that one. I know what that is.
I know you do. Keep reading.
Then why you just
Aggression and clank porn, everybody. Oh yeah, by the way,
message across is to look the other person directly in the eye and say no in a firm, non-sensical tone of voice. A final thought: society creates expectations about what is appropriate behavior for men and women. While growing up, we get messages from our families, our peers, and media about how young men and women should behave. These expectations are called stereotypes. Stereotypes may cause us to ignore our true feelings and behave a certain way because we think is how we should act, not because we really want to. Stereotypes can also cause us to overgeneralize and make statements such as all guys ever think about is sex, or all girls say no when they really mean yes. Stereotypes can be dangerous when they are caused to overlook individual differences. For example, a fellow may not be able to hear no when the girl says no, if he believes the myth that all girls say no when they really mean yes. What to do and not to do if you're raped. Rape victims have many feelings that are common to all of them, despite circumstances of rape, including date rape. The feeling of fear, anxiety, shame, guilt, loss of power, and isolation. Some people have those feelings right away, while others are so stunned by what happened that it takes a while for these feelings to surface. It is important for you to understand that to have no reason to feel guilty. You did not commit the crime. The rapist did. He silently forced you to perform an act against your will, violated you, and caused you physical and emotional pain. Turn it down, Tyler. 20. Shut up. Alright. I forgot where I was.
Keep reading.
And I'm trying to find advice. Don't let that person or anyone else tell you that it was your fault or that you provoked the rape in some way. Even if you were disobeying your partner at the time of doing something you weren't supposed to do, does not mean that it was your fault or that you were asking for it or you deserve to be raped. If you are raped, you should do the following: go to a safe place and call the police immediately. Then call an adult you trust to come and stay with you. Preserve all physical evidence. Do not shower, bathe, or douche. Save the clothing you were wearing at the time of the rape. After reporting the crime to the police, go to the hospital emergency department. Even if you don't feel injured, it is important that you receive medical care, as you may be in a state of shock and not be able to evaluate the extent of your injuries. Also, the evidence documented by the medical staff may help in prosecution of the attacker. Many victims feel better after making a police report. Helps them regain a sense of control. The sooner you report it to the police, the quicker the person who attacked you will be caught and stopped from harming anyone else. Many police departments have female officers available to take your report, and most police departments now provide special training for their officers so they can treat victims of rape in a caring and sensitive manner. Even after you have reported the crime to the police, you may still have feelings of fear and isolation. It's important to express your feelings. Don't hold them inside or feel ashamed. The sooner you talk to someone about what has happened, the better you will feel. Talk to someone you trust, a family member, friend, or pastor. Also, it will help immediately talk with a professional counselor with a rape treatment center or crisis center. They're to help you. Special note about date rapes. Everyone states above also applies to date rapes. If you happen to know the man, it does not make the rape excusable. The rapist has still committed a crime of violence against you. By reporting to the police, you also gain a sense of control and help others from being victimized. If you're in college, you may also want to consider reporting it to the campus authorities. Does anyone want to read the next chapter?
Make Jonathan do it, and I'll do it right after Jonathan.
Alright,
Come on, get that ass kicks off of you.
Ben off.
Eric, I can't hear the music because I
Man,
tried.
stop getting boners.
Ben,
I don't want to get demonetized, Eric.
Ben's sitting there watching porn.
Hey, let me
Get
sit
out
there.
of my way.
Hey, I was sitting there.
No, it's my chair now.
I was sitting there.
No, it's my
Get
chair.
up.
It's still my chair.
Take it.
I bought it.
Then why is it in Eric's room and has been in Eric's room?
No one bought it.
Everything,
I did.
pretty much everything in here, your mom bought.
So it was stolen? Question mark.
I bought the house. What are you talking about?
About drugs.
I bought the mom, so I bought everything
About
else.
drugs. Tobacco. We all know that using tobacco in any form, smoking or chewing, is hazardous to our health. It causes cancers of the mouth, the lung, the bladder, as well as heart disease and emphysema. Impairment of breathing. In other words, it is also damaging
Might be too loud.
that the surgeon.
Oh,
I thought someone was hitting me. About It is so damaging that the Surgeon General of the United States has forced the tobacco industry to print warnings on cigarette advertisements and packaging. Adults are also presumed to be old enough to know the difference between what's beneficial and what's harmful to their health. Adolescents who are not often experiencing frequently do not know how addictive tobacco can be. That's why selling cigarettes to people under the age of 18 is against the law. Now let's take a closer look at this bad habit. Smoking makes your breath smell, your clothes and you stink, and your teeth yellow. It's also expensive. It makes non-smokers avoid you, particularly indoors. More and more smokers are becoming social outcasts. It is, to put it bluntly, a stupid habit. It does nothing for you, a lot of things to you, and drives others from you. If you want to smoke because you think it looks grown up, don't. If you are speaking, young men have told me they prefer girls and women who don't smoke. So your grandfather smoked like a chimney and he lived the ripe old age of 88 while good for grants. He was one of the lucky ones. Maybe you'll inherit grandpa's luck and maybe you don't. It is not the harmless pastime it was thought to be in the 1960s. Over the years, many regular users have written to me insisting that pot is absolutely harmless and should be legalized, like tobacco. They insisted, relaxed them, and they have been smoking it for years without suffering any ill effects. But I've also heard from school teachers who tell me they can spot a pothead at 3 feet. They say he or she has a glassy, furrowy look and his chronically bloodshot eyes. He has fuzzy memory and lacks motivation. There has also been much bunk printed about marijuana that I can't blame you for rejecting everything you have heard or read about it. But here are some facts. Studies show that the younger you are when you start using marijuana, the heavier the use becomes. Since the early 80s, drug clinics have reported that some smokers suffer from severe anxiety reactions. Having smoked too much marijuana too fast, these patients may require support from an understanding person or an emergency room. The reactions can vary. Some people smoke a joint occasionally and never suffer any visible effects, while others get giggly, drowsy, or talkative, and act like they are drunk. Much depends upon dose, quantity, and purity as how the individual behaves when stoned. The person who has an unstable personality or emotional problems shouldn't use any kind of mind-altering drug, and marijuana is certainly one of them, because it has very little effects to mess up his or her head entirely. It takes very little to mess up. Effects on the brain. People who use marijuana every day, chronic users, can suffer from serious or premature memory disorders as they age, impaired judgment, and false sense of well-being, a reduced attention to the concentration span, increased drive and ambition, loss of motivation, I'll do it tomorrow, I don't feel like it today, high degree of distractibility, impaired communication skills, the pothead repeats himself a lot, the damaging or killing of brain cells linked to memory. This results in reduced learning ability because the chronic user is not able to retain information very long. Driving performance is impaired, and frequent judgment of speed is no longer time required, and longer time required for braking. Effects on the reproductive system. Tetrahydrocannabinol, or THC, the active ingredient in marijuana, causes changes in the reproductive system of test animals and humans, and may have an adverse effect on reproductive functioning. Although not consistently confirmed, THC often increases the female sex hormones estrogen and progesterone, and interferes with ovulation. In male mice, it inhibits the production of sperm. Effects during pregnancy. Pregnant pot smokers are now giving birth to babies with an increased frequency of birth defects. Marijuana is also associated with lower infant birth weight and greater frequency of premature births. Children born with heart disease and spinal problems are also reported in increasing numbers. Taken altogether, these findings certainly suggest that the use of marijuana during pregnancy is highly undesirable. Effects on the lungs. Regardless of what you have heard to the contrary, studies confirm that smoking pot damages lungs and bronchial tissue. Chronic marijuana users report many of the same health problems as cigarette smokers. An increased frequency of bronchitis, emphysema, and bronchial asthma. There is a much higher carcinogenic, cancer-causing content in marijuana smoke than tobacco smoke. Because of the method of smoking pot, deep, prolonged inhalation, and because of its chemical composition, pot is even more harmful to the lungs than tobacco. Recent studies have shown that smoking 3 joints produces approximately the same lung damage cancer risk as smoking 16 or 5 times as many cigarettes. Why? Of course, marijuana in combination with alcohol and other drugs compounds the hazards. Studies, though, show that smoking marijuana while shooting up cocaine may cause severe increases in heart rate and blood pressure. Using substance to get high is a bad habit. It keeps you from facing your problems and handling them as a constructive, mature way. Pot also serves as a getaway drug, which means the chronic pot smoker is more inclined to try other recreational drugs. So, I think you will agree that there is now sufficient evidence to conclude that pot is not the harmless drug we thought it was to be a few years ago. And by the way, it was still illegal. Cocaine or coke. Cocaine hydrochloride is a very powerful stimulant. It gives the user a great spurt of energy, which can keep him going for several days without sleep, as long as he does not run out of cocaine. While reputed at first to be non-addictive, cocaine has turned out to be one of the most powerfully addictive drugs of abuse. Powerfully addictive, yeah. It is not the man-made drug. It is derived from the leaves of a South American coca plant, hence its name. Coke comes in several forms. Powder, which is usually sniffed in nostrils, but is sometimes injected. Physicians have reported seeing an alarming number of patients with the linings of the nostrils burnt out, as well as severe and irreversible sinus damage from having snorted cocaine. Run immediately, more, just to feel non-negative. High doses or prolonged use of cocaine can cause blackouts, convulsions, paranoia, strokes, and cardiac arrest. Some individuals are particularly prone to sudden death, which could occur with the first use of cocaine. Cocaine-related deaths are by result of cardiac arrest or seizures followed by respiratory arrest. Cocaine use while pregnant has been related to high rate of fetal loss.
Eric, I'm blind right now. Like, it's so foggy, yeah. It's literal fog.
No. Cocaine use while pregnant has been related to high rate of fatal loss during early pregnancy. Withdrawal symptoms include mild to severe depression. Because it is so highly addictive, people can go to extremes, even selling their homes or their bodies to get crack. Fortunes have literally been blown trying to maintain a crack habit. PCP, or angel dust. The boy woke up with a gas tank. He found his mother in another room, stabbed to death. But he had no memory of what had happened. But police said he had written on a wall with red marking pen, "I love my mothers and I didn't mean to kill. I love my mother and I didn't mean to kill her." That is from the files of the New York Police Department. The boy who killed his mother had smoked PCP, also known as angel dust or hog. By any name, it's a very expensive way to escape reality. Fencyclide, fencyclidine, or PCP, was first manufactured as a human anesthetic, but because of undesirable side effects, was discontinued. It became commercially available in the 1960s for veterinary use. Then, in 1978, the manufacturer stopped production. As a result, virtually all PCP in the United States is now manufactured in small, hidden, illegal laboratories. This adds up to the potential for disaster because such laboratories are not examined for cleanliness, and the drugs produced in them are frequently tainted or contaminated. Suppliers of PCP never really know what they're getting. PCP, or angel dust, causes varied reactions, a sense of detachment, image distortions, like a funhouse mirror, visual hallucinations, hearing things that don't exist, mood disorders which produce severe anxiety and a feeling of impending doom or paranoia, confusion, disorientation, euphoria, and violent hostility. These effects, or flashbacks, have been known to recur long after the drug has left the body, sometimes several months, and as long as 1 or 2 years. Police have had to use special techniques to subdue users who think they are invulnerable. LSD or acid. Many users have claimed that LSD introduces them to greater awareness of their senses, expands their consciousness, gives them a deeper appreciation of colors and sounds, and transports them on a trip to another world of highs and excitement. This may be true, but regardless of how good trips you've had, you cannot predict when the next one will be above it. LSD is a man-made or chemically manufactured illegal underground laboratory. Tasteless, colorless, and odorless, it comes in many forms and takes only a tiny amount, hardly visible to the eye, to send the user off on a trip. Many reactions reported to be from the LSD are not caused by LSD alone, but rather the combined effects of LSD and impurities, additives, and other drugs which are sold as LSD. The combined effects may affect the user in unpredictable ways. LSD can also cause severe psychotic symptoms or episodes, commonly referred to as bad trips. Excuse me.
What's the next chapter?
Excuse me.
Just keep reading.
I don't know. I'm coughing. Bad trips have reduced some LSD users to vegetables. The mental damage triggered by this drug may last hours, days, weeks, months, or even forever. It produces hallucination of all kinds. The feeling that one can fly has sent users out of windows and to their deaths. LSD is not itself physically addictive, but after having experienced one fantastically good trip, the desire to experience another is natural, and therein lies the danger. Flashbacks, referring to hallucinations, have occurred frequently after use of LSD, and many have been nightmarish. Many physicians have reported that long after a patient has quit using LSD, and for extended time after the drug has been eliminated from the body, flashback can occur. Heroin. Heroin is a brown or white powder, depending upon the country of origin, that can be smoked in a cigarette form or a pipe, can be sniffed, snorted into the nostrils, or combined with liquid and injected into the veins. The effects of heroin also include lack of motivation, euphoria, drowsiness, slowed pulse, constricted pupils, flushing of the skin on face, neck, and chest, and constipation. The effects of overdose are convulsions, respiratory arrest, coma, and possibly death. Withdrawal systems are painful. If a heroin addict doesn't have a fix every 10 to 12 hours, he or she develops chills, and fever, nausea, stomach cramps, diarrhea, and vomiting, followed by hallucinations, runny nose, teary eyes, tremors, shakes, and sweating. Heroin junkies can be cured, but statistics indicate that only 10% to 15% are ever permanently cured and rehabilitated. There is a high incidence of liver disease, destroyed lungs, and general poor health. Sometimes it takes years of medical and psychiatric treatment to rehabilitate a heroin addict. With the appearance of AIDS, which can be spread by addicts sharing unsterilized needles then sexually transmitted to their partners, or if they are pregnant to their unborn babies, there is a growing incidence of death among heroin users and their partners. In 1990, HIV/AIDS was the second leading cause of death among U.S. men between the ages of 25 and 44, and the sixth leading cause of death for women aged 25 to 44. A medication called methadone has been developed for heroin addiction. It does not cure the addiction, but does prevent withdrawal and relapse. Government-supervised methadone clinics, which have been lifesavers for heroin addicts, have been set up all over the USA. Because of methadone, heroin addicts are now able to lead normal, productive lives. Are you, have a little drink? How about, would you like to read this or me? Yeah? What would you like to?
I'll read it.
Okay.
Oh, there you go. Just switch, areas. Do a 180. So, or just go up.
Yeah. Oops. Fuck you! Oh, I thought you tried to hit me.
Have a little drink. Now about drinking. Are you afraid to say no when someone in the crowd says, "Oh, come on, have one"? Don't be. If someone offered you a Coke and you didn't like Coke, you wouldn't hesitate a second to say no thanks. It's just as easy to turn down beer, wine, or liquor, and far, far wiser. Those in your crowd who really count will respect your refusal. Why should you care what the others think? Alcohol dissolves almost anything, including your judgment. Under its influence, you may do things you shouldn't and wouldn't do normally, such as having unprotected sex. Most people think of an alcoholic as a smelly old bum sleeping it off in a doorway. But would you believe there are alcoholics as young as 10 years old? Or that automobile accidents caused by drunken drivers are the #1 cause of death among teenagers? Teenage alcoholism is so widespread that many states are upping their drinking age limits. It's true, alcoholism is now considered a disease, not a character flaw to be ashamed of. Now, just why one drinker becomes an alcoholic and another doesn't is still a puzzle. But one thing is certain: alcoholism is self-induced and destructive. This is not to say that a can of beer or an occasional cocktail will start on your way to Skid Row. For the vast majority, it won't, but for a few, alcohol can be a bomb, a time bomb. How can you tell? There are clues. If you're having 3 while others are having 1, you need to drink to make you feel more relaxed, comfortable, and at ease with people. You drink because it gives you self-confidence and courage. You turn to alcohol in times of stress or trouble to forget. You drink alone. You take a drink to help you get over the effects of the night before. Then you could be an alcoholic and shouldn't drink at all. Even if you drink only beer and you become an alcoholic, it's not what you drink, but how much. If you think you have a drinking problem, help is as near as your telephone. In every city, even in small towns, there's an organization called Alcoholics Anonymous, better known as AA, whose members, all of whom are recovering alcoholics, are ready to help your night or day. Helping others is one of the ways they fight their own continuing battle with alcoholism, and it works. And it's free. It's also anonymous. No one will say he or she saw you there. You don't have to sign up or join anything. In fact, you don't even have to give your name. Alright, let's assume you are not an alcoholic. You're a normal, healthy teenager who has just discovered that a beer or two, or maybe a shot of vodka from the old man's liquor cabinet, gives you a lift. It makes you feel good, happy, and exhilarated. It adds to your self-confidence, moves your inhibitions, and makes you much more sociable. Maybe so for a while, but the effects of the high wear off in time. And when they do, you'll feel let down, depressed, and blue. Alcohol is not a stimulant, it's actually a depressant. Add to that knowledge that the removed inhibitions may cause you to do and say things which can cause a great deal of embarrassment once you've sobered up. Things you never would have done, including getting violently ill. If you're unlucky, you can pass out, and when you come to, you will have to ask, what did I do or what did I say? Now who would want to be in a mess like that? I realize that a few lines in a booklet will not keep you from having a drink or two if that's what you want to do, but there are good reasons why serving or selling alcohol to minors is against the law. If you decide to ignore the law and indulge, I implore you to know your limit, and never exceed it, and never drive while you are under the influence. P.S. Emerson said, moderation is essential to the enjoyment of everything. Wise men, Emerson. On staying alive, this booklet would not be complete without a particularly dramatic column I published a few years ago. It made a tremendous impact on my teenage readers. They wrote by thousands urging me to repeat it at least once a year. I was deluged with requests for permission to reprint it in high school and college newspapers. I did not write the piece. It was sent to me anonymously. When I asked the author to please come forward to claim credit, I regret to say that dozens of authors surfaced. To date, none has provided conclusive proof of authorship. After reading this chilling piece, perhaps you will join the many teenagers who are proud to be safer, saner, and more responsible drivers from this day forward.
Not with real swords, but we got a sword fight sometime. Huh?
Alright, you read the rest.
Okay.
There's like none left.
Gotcha. Please got him on the 17.
Oh, right there.
Yeah.
Okay.
How many pages is there?
You want to see how difficult this shit is?
Yeah. Hi again.
I should start doing that. If I started doing what you're
Please
doing right
God,
now,
number
I'd get it
17.
down faster.
The day I died was an ordinary school day. How I wish I had taken the bus, but I was too cool for the bus. I remember how I wheeled the car out for Mom. Special favor I pleaded.
How are you supposed to get all those?
On the 250 bill ride, I threw all my books in the locker. I was free till
After
8:40
just
tomorrow
that?
morning.
Can you get
I ran
battery
to the
life back?
parking lot, excited at the thought of driving
Can
a
you get
car
battery
and
life
being my
back?
own boss.
Yeah.
Free.
Yeah, if you do that.
Doesn't matter how the accident happened. I was goofing off, going too fast, taking crazy chances.
Where you don't have battery
But I
life?
was enjoying my freedom and having fun. The last thing I remember was passing an old lady who seemed to be going awfully slow. Heard the deafening crash and a terrible jolt.
Wait, does battery energy mean
Glass
you
and
don't
steel
fail if they
flew
stop losing
everywhere.
energy?
My whole body seemed to be turning inside out.
If you
I
fail,
heard myself
if you
scream.
lose all your energy.
Suddenly I awakened. He was very quiet. The police officer was standing over me, and I saw the doctor. My body was mangled. I was saturated with blood. Pieces of jagged glass were sticking out all over. Strange that I couldn't feel anything. Hey, don't put that sheet over my head. I can't be dead. I'm only 17. Got a date tonight. I'm supposed to grow up and have a wonderful life.
Oh, I see why.
I haven't lived yet. I can't be dead. Later,
You're gonna
I was
wanna
placed in
adjust
a room.
and
My folks had
Eric,
no idea.
adjust it.
Why did they have to see me like this? Why did I have to look at
Eric,
my
look
mom's
down
eyes
at
when
your
she
feet.
faced the most terrible ordeal of her
what was
life? Dad suddenly looked like an old
Dragon
man.
might be really
He
far
told the
away.
man in charge, yes, he is my son. The funeral was a weird experience.
Can I help
I
you
saw my
turn off the
relatives and friends walk toward the casket. They passed one by
But
one
I don't
and
think it's an issue with
looked at
traffic,
me
though.
with the saddest eyes I've ever seen.
I think
Some
it
of my
makes it
buddies were
easier for
crying.
the family to
A
just-
few of the girls touched my hand and sobbed as they walked
Lights
away.
the camera cannot see anything.
Please, somebody wake me up.
Maybe like a lamp.
Get me out of here. I can't
Why
bear
not
to see
try
my
it?
mom and dad so broken up. My grandparents are so racked with grief they can't hardly walk. My brothers and sisters are like zombies. They move like robots. In the days, everybody... No one can believe this. I can't believe it either. Please don't kill me. I'm not dead. I have a lot of living to do. I want to laugh and run again. I want to sing and dance. Please don't put me in the ground. I promise you give me one more chance now. Be the most careful driver in the world. That's all I want is this one more chance. Please God, I'm almost 17.
Holy shit.
It looks like sirens.
Eric, you have like 170 combo.
Yeah, there's no sirens. The language of parents. I know this booklet is for teenagers, but sometimes there's something needs to be said in
You got a
the
ridiculously high one for this.
Sociologists and psychologists have interviewed teenagers with the subject on what's better than. This is what our youngsters have said they want. Love.
No, if
They
you
want
watch Eric,
parents
you'll
who
realize
help
his
them
crossovers
unconditionally.
are like, he
Understand.
does it really easily.
They want parents who will listen and
He
at
wants
least
them
let
to
them explain.
scam.
Kids need desperately to be
He does
understood.
it with like slight of
Trust.
risk.
They
and
want to
just
be
keep
trusted.
going. I haven't figured out
They want their
the
parents
easy
to
way.
expect the best of them, not for the worst. Joint planning. They want parents who will stand beside them, not over them. They appreciate guidance in the major matters. But after they've proven themselves and have fairly mature judgment,
Actually crossing.
they want to be
You're
allowed
not
to
even
try their
actually
ways.
crossing. I see your hands. You're not really crossing.
Privacy. They need room for their own to retreat to,
Yeah, or
and a place to pursue their hobbies and store their junk. They don't want their letters read or their
hard
phone
work.
conversations listened to.
yeah. If I put in like 10
Responsibility.
seconds.
There we go.
Um,
Okay.
They want their
No,
share
it's
of
this
family
one right
tasks,
here.
but they'd like to know who's due
There it
to
is.
do what and why. Friendships. They want the right to choose their own friends, and unless these friends...
No!
So close! Oh,
No!
I yelled
wanna
too
try?
loud. No, not quite.
I want to try.
Looks like there are sirens in the back.
For plus.
Me!
That's gonna fail harder than I am.
Try 3 tries.
You almost
and we'll
done?
whole loop.
But yeah, but they'd like to know how to do what and why. Friendships. They want the right to choose their own friends, and unless these friends have a reputation for being bad company, such as boozers and dopers, they want them to be welcome in their homes.
No, play Warriors to its
So
extent.
ends the Teenage Bill of Rights. How much it applies to your home for what you decide, for you to decide. But don't ever say that you don't know what your children want. Right or wrong, I think they've made it completely clear. Don't you? Also a parent.
Well, that's Dear Abby.
Well, that is Dear Abby, and it took about 2.5 hours. My voice is tired. Also, sorry about
It's
this
your
stuff.
boy, Retard, signing off. See ya.
Eat. Later.